welcome back. Today we are going to do a quick video. I'm going to bring a few people in here and we're going to talk about splinting. So here we go.
This close.
Hey guys, I'm Jen. I'm a PA.
And I'm Jill. I'm not. I'm an APN.
So we are going to give you guys some tips and tricks for applying splints today on our wonderful model, Alexa.
We're going to walk you guys through one whole splint so that you guys can see how this kind of works. We'll probably do the ulnar gutter because it's probably one of the easiest ones. So you need a couple of different supplies. You need the pre-wrap, the web roll, which is basically just a very thin strip of cottony type material. And Alexa, which arm would you like to break?
My right one.
Your right one.
And take your hair tie off.
Okay, so basically there's a couple of different splints, and we'll go over all of them, but the one we're going to show you first is the ulnar gutter, which is often used when you break this aspect of your arm. So, let me turn this way, and I know your arm's broken, but it's all good.
We also apply ulnar gutters for boxer fractures.
Yep.
Which we see commonly.
Okay, so whichever area is broken, whether it's up here when Jen was talking about the boxer's fracture in the hand, or whether it's down here in the wrist or the forearm, just make sure that area is very much padded. You want to make sure you wrap the arm so that the padding goes farther than the splint so that nothing is rubbing against the skin. So the biggest thing that this is used is for protection. What sometimes people get confused about is like exactly how to put the web roll on. It does not have to be applied in one single layer all the way, because often that creates a lot of creasing and that can cause skin breakdown once the splint actually gets on. So I actually will wrap as much as possible. Now Alexa has a very thin arm, so hers is going to be hopefully a little bit easier, but sometimes you don't always have that. So let's say they're broken more down here or even in the hand. You don't have to splint all the way up to here. You know, you want it to be comfortable for the patient. So you can always ask your provider like how far you want the splint to go up. You know, for example, if they break down more down here, you're going to need it to go a little bit farther so that that break is actually supported. So when you go to put the pre-roll on, obviously everybody has their own different techniques, but I kind of wrap it. Go ahead.
No, I was going to say, make sure kind of how, I've seen some people kind of start rolling this direction, but you actually want to be rolling with the kind of the outward. So, and like Jill said, most of the time we come down, usually about 2 finger lengths from the antecubital fossa areas where you want to come down to. Where do you usually start applying it at?
It kind of depends on the patient. Sometimes I'll wrap from this way to this way, but sometimes I'll go. It really just kind of depends on my preference and what their arm looks like. But I feel like it probably is easier to wrap going this way here. And like Jen said, often you're gonna go down pretty far depending on where they're fractured. If it's an isolated finger, I don't go all the way down to here. I probably just stop more like down here, but it kind of depends. I think the process is to not cut these. Okay. All right.
Why wouldn't you want to cut those?
Because it can cause jagged edges.
Yeah.
I used to cut them all the time. Okay. So when we're wrapping, you know, if you get to a point at any point where you're like, oh shoot, it's creating a really big like crease, go ahead and just break it off. So it's okay to have like individual layers if that's causing you a problem. You can do that the whole way down if that's what works for you. You know, you can kind of cut this whole way down and layer it. But often you can go ahead and wrap, you know, in one single solid fashion. We'll take this one off just so we can kind of show you that too. But like I said, if it ever gets to be, yeah, I kind of use, sometimes I'll wrap this part separate too. It really just depends. But like I'll wrap the hand like completely separate. But you can basically just start to roll it like this. If it starts to get annoying to you, just break it off and keep going. So that way you keep it in nice solid fashion. So as you can see, when you get to that bigger part of the forearm, it naturally wants to curve and start going that way. So I'd probably say mid forearm, I usually have to break it off and start a new wrap. So, like so. Nice and padded there. Okay, and then sometimes I'll take the smaller one to wrap the hand just because it is easier. Do you want to wrap the hand?
Sure. Are we doing ulnar gutter?
Yeah.
So with ulnar gutter, you're basically going to keep the 4th and 5th fingers and wrap those. So a lot of times, And you want to make sure too, when you are doing an ulnar gutter, you need to, which I told you guys to do before I did this, you need to put some padding between the two fingers. You don't want them getting macerated or. Okay. And then you can kind of treat the rest like you would do your normal kind of.
You can see there where she made a small slit in that cotton padding to kind of help the thumb fit in a little bit better. That's completely fine to do as long as you've got that padding covering the whole entire hand.
Totally fine to rip it, guys.
Alexa, did you punch a wall?
I did.
I was a little angry.
She got mad at Shelly.
So I sometimes will just put like a little tear halfway through, that way it'll fit kind of right there at the thumb.
You can even put, like if you're using the bigger wrap, if you're using this one, some people will even put a hole like right in the thumb, and that's fine too, to kind of wrap around like so. Whatever is your preference, it really doesn't matter. As long as you're padding the area, especially the area of the fracture, really well, you'll be fine. And yeah, you can even take scissors and kind of trim around too. You just want to make sure that there's not, so this would be an example of like creasing. So like you don't want to have this all wrapped and you've got like twisted here. Like you don't want to do that and have all these creases and kind of go around like this is, although right now it's actually doing okay, but you don't want it to have a bunch of creases to where you're going to cause that skin breakdown.
Correct.
So that right there would be something you don't want to do. There we go.
So make sure the rest of the
Wrist is well padded. There you go. So hold up your padding. You can see that it's just nice, solid fashion. There's no big kinks that's going to cause her any issues. Like so.
It's like Rookie of the Year.
Yeah. All right. Then you need to get your splint wet. You do not have to drown this in water. Sometimes I'll hold it open and kind of let it drain through the middle, but I've kind of found that with these newer splints that we have, that gets them really, really wet. So I don't seem to do that as much with these newer ones. But you just get it nice and wet. And you have to remember that the more you kind of touch these splints, the more you're going to form your imprint into them. So get them wet, take a towel right like so, and you're going to dry it really good. It's okay to kind of move it and form it to dry it out because you don't want it to get so wet that it completely soaks that padding and kind of defeats the purpose of the padding. Okay, so it's kind of just damp. It's going to form as it goes. So you don't want to get this ready to go until you actually are ready to put the splint on. So let's say she's got this boxer's fracture in her finger here because Alexa punched a person or a wall or something like that. We know she's kind of a violent person. Okay, no, she's not. She's sweet. Okay, so basically your patient can usually, when it's their arm, they can kind of help you like so. And whether you splint them in a stretcher or in a chair, it doesn't really matter. You just need them to be able to hold their hand up for you so that they're not like holding it way down here and you're trying to like go underneath here and wrap it. So have them get their arm up like Jen had her do, just for sake of being able to hold it. Honestly, it's always really helpful to actually splint with two people if you can, just for ease of not having to do it all by yourself. So like so, I'll hold this for Jen while do you want to wrap it or do you want to? Sure. Anyway. So Jen's going to put this splint onto the ulnar gutter side, which is basically going to create a little alley so that her arm can just kind of fit in it. Now you want that hand to be in the anatomical position. You don't want their hand to come forward like this. You don't want it to be bent back so far. You basically just want it to be in that nice neutral anatomic position where their wrist is kind of naturally flexed a little bit, or extended, I guess would be extended. And then you start wrapping like so. So once again, I wrap from up front. I usually wrap all the way around. You can wrap in between if you want. Kind Kind of just really depends. Do you have a preference on which way you do?
I do between the fingers, but it's okay.
Either way is really okay as long as it's padded. And for the hands and the wrists, these red or yellow ones are okay. I went ahead and just did a red one just because the ulnar gutter is easier to do that. The yellow ones are the real tiny ones, which you can absolutely do that too. But I usually do one red and one blue, and that just gives them enough support, and it gives you enough bandage to kind of cover. The other big thing that I do is I make sure that ACE bandage goes further than the actual splint. That helps keep like junk from getting down in there and stuck. Like so. And then honestly, you just kind of fasten it here. Now you have to remember when you're actually splinting someone with a broken bone, it's painful for them. But the goal is to just let this kind of form and harden on its own. You don't want to go like this. You don't want to push your hand into this because you're going to create these fingertip marks and you're actually pushing into the cast. Now obviously I'm doing it to Alexa because we're going to take this one off. But you don't want to go like this and put your fingers in it and or squeeze it like this. Okay, if anything, you want to use the palm of your hand and kind of softly go like this. Now it's going to form on its own. So as long as you've got the edges formed and you allow her to just sit, then you can either put a pillow underneath her or you can just sit here with your palms. Now, she's a very helpful patient, but go ahead and let your arm go. If it falls down and you've got to do all the support, that's fine. Just sit here and hold it. You don't have to squeeze. Just make sure you've got it nice and wrapped. And you have to hold it for sometimes 3 to 5 minutes to really get it to harden. And then once it is, she's kind of set. Now, if you need to adjust her hand once you get it in the cast, you can. Just be careful to not use your fingertips. How's that feel, Alexa?
Feels really comfortable.
Does it?
I like it.
Okay, so once it's all hardened, then she's going to be ready to go. Big things about teaching patients about their splints. So you yourself, even as the tech, I know the provider checks these, but go ahead and check your splint afterwards. Check their capillary refill. Make sure they can move all their fingers. Ask them about their sensation. See, does this feel numb? How does this feel to you? You're not going to be really able to get in there and feel a radial pulse, but possibly, depending on where you've wrapped it. An ulnar gutter, you sort of can. But the biggest thing is just making sure your splint looks like it should. The splint care. So if you're going to teach them about splint care, the provider needs to do that as well. But splint care involves not taking your splint off unless you absolutely need to. Not getting it wet so they can't bathe with it. They have to either wrap saran wrap or a baggie and tape it. And the biggest thing is to not take it off until they see the orthopedic surgeon, unless absolutely necessary. And honestly, I would just let the provider talk to them about that. But the biggest thing is how to kind of handle the splint. So don't stick anything down in it, let anything break off in it. Don't take it off unless they absolutely have an emergency with it. Otherwise, just leave it be. They sleep in it. They do whatever they normally do.
Hopefully they shower.
Yeah, or just tell them not to shower and then they don't have to worry about it. Okay, so that's the ulnar gutter. We'll go ahead and take this one off, and then as far as wrapping a splint, they're really all the same way. You don't wrap any of them with different wrap or use different ACE bandages. They're all with the same type. As far as measuring the splint, most adults with their arms are going to be the 4x15. If it's a very, very small adult or a teenager or a kiddo, you're probably going to be more in that 3 to 12. I don't think we have a 3x15. I think just 3x12. So mostly that 4x15 is what you're going to use. This was a 4x15 that we used with Alexa, and it like so. All right, so we're going to do a Volar splint now. Alexa's wrist has been wrapped. She broke her arm again. Distal radius fracture here.
Active summer.
Foosh. Yeah. Yes, she had a foosh injury, a fall on the outstretched hand. Okay, so when you're doing the Volar splint, this is the one where they kind of have you hold your wrist out as if you're holding a can of soda, just kind of in that natural anatomic position. You don't want it too far back this way. You don't want their hand this way. You don't want their hand straight. Okay, the hand is never straight. You got to think of it. If you just relax your hand right down at baseline, your wrist has a little bit of a natural curve.
Yep.
So that's what you're going to have her do when you're splinting her here. So remember, she's broken down in this area, or sometimes even both sides. It's not like it's one specific fracture that you wrap this for. Okay, but basically same type of thing. So she can hold her hand up. Again, if you can have a helper that can help you hold this splint, you're going to bring the padding right up to basically her fingers, supporting that supporting this wrist, okay? So this time the volar splint is going on the volar aspect of that hand, which is that belly side of the arm, okay? So same thing, you're gonna wrap the splint over so that it's covering just up to her elbow. You don't want it to go past the elbow. And then you're basically just gonna wrap her like so. Again, making sure that you're kind of covering that whole hand. Now, more often than not, you need them to be a little bit active in their own splint placement. And a lot of times they can do that for you. You just have to remind them to keep their hand in that natural position. Okay, so then you're going to come down here. This is the blue one here.
Sake of coverage.
Yes. And then same thing. Down here you're just wrapping and keeping this nice and tight. Just like Jen kind of had that edge held out so that it's not winged out and causing them problems. The better you can kind of form it to their body, the easier time they're going to have. So form that, kind of down towards their body instead of like straight out. You're going to need to do that before it hardens too.
A lot of times after Ulnar Gutter, or I guess we're doing Volar, I'll sometimes kind of hold a patient's hand just to kind of get them in that position of function. But
So they don't go home with Barbie hands.
that's right. We'll pull my hair out of that splint. Sometimes I like to leave a little piece along. Okay. So basically, if you just hold that in place just like so, 3 to 5 minutes, it'll form well. And then honestly, just how she's doing, the same thing, if you want to kind of help her, once it's formed, just kind of help her keep her arm like up with a pillow, with your hand, it doesn't really matter. This is already nice and hardened already. So basically, if you want to hold her hand a little longer, you can. But otherwise, just let it get nice and hard. Do the same thing. You're going to check their capillary refill. You're going to make sure she can move her fingers. You're going to make sure it doesn't feel numb for her. When I said move your fingers, I meant move your fingers.
Good at following direction.
Yes. And then that's basically your splint. So when you look at it when it's all said and done, see how it kind of goes up, and then her wrist kind of naturally bends a little bit backwards, just like normal, like so. You don't, with this one, that way, you don't really have to include the thumb, okay? It's wrapped, but it doesn't really serve any specific splinting function. So as long as you've got that splint covering that belly side of the arm, that lighter color, the inside of the arm, that's your volar. All right. So for the thumb spica, I've already kind of been wrapping it through, but like we talked about, you can either rip the hole in the thumb and kind of put it over this way to help pad, which is what I was starting to do. And then I guess everybody's kind of got their own little thing, but I just take this smaller one, and just kind of make sure that padding gets nice and around. You can do a couple layers. You can do whatever kind of makes it most padded. Your fingers are purple.
Yeah, this is
little rain-ons. Okay, go ahead. It's
All right.
padded enough.
So, we will. Are you going to wrap around the thumb here? Although we don't want it to touch because you don't want to.
It's kind of hardening. It's okay.
So you don't actually want both sides of this to wrap around completely. And just in case her thumb were to continue swelling, you don't want it to know.
Now the thumb spicas are going to be used especially for like your scaphoid fracture, those snuff box tenderness fractures. So a lot of times it's going to be the fractures that are up in the wrist or in the thumb. If you've got kind of a snuff box tenderness with like a distal radius fracture, a lot of times a thumb spica is used. Basically any fracture kind of near that thumb or in the wrist that affects the thumb. Actually, so we kind of let this splint harden before we wrapped it. So this is kind of actually what I was talking about in the last video that Jen did a much better job than I did. You don't really want these wings coming out because it's uncomfortable. So before you wrap, kind of bring them down. So we'll just pretend like we did that before. But this can be uncomfortable for the patient. So you don't want that part to be like pointed. So when you're wrapping, definitely focus here, which is why it's helpful to have two people. I just wasn't paying a whole lot of attention. But same thing down here. You're going to want to keep that held down so that it's not coming out into a point. But for this thumb spica, she should be able to freely move all of her fingers, and really just this thumb and that radial aspect of the wrist and arm is isolated. So, but you still want to make sure she can move the thumb like she can. Don't mind Alexa has Raynaud's, so her hands are a little different. Mm-hmm. But you want to check her cap refill, avoid, There. Okay, so it's nice and hard. Same thing. She can go about her day. Same type of splinting teaching that you leave it on. You don't take it off to shower. You cover it. And there's your foot spica. Okay, so for your posterior short leg is the only type of leg splint that the tiger nurse will do. Anything that requires a long leg, like on a kiddo or something, the provider will have to do. So examples of fractures are certain types of like Jones fractures in the feet, or like your distal, like tib fib or something like that. Jen's doing the wrapping. The wrapping is the exact same. You want to do the same padding situation. You don't want to have it twisted or turned. You want to keep it nice and protected. Again, you're never going past the knee. You're never going all the way up here. That's a long leg. That's going to be done by a provider. But just like Jen's still kind of doing the 2-finger breath below the patella. She's going to get down and wrap her foot. We've left Alexa's sock on for sake of lack of pedicures.
For video's sake.
For video's sake. But whether you splint in a bed or on a chair, it's really going to depend on who's there to help you. Having 2 of us and an actual not broken leg is much easier in a chair. But if you want to get them on a bed and get their leg lifted up and elevated, you're going to have to do that in certain situations where they're older or if they can't help you with their leg. You have to remember if their leg is actually broken, that's going to hurt her to be kind of dangling it by herself. And even if you're helping hold it, you're going to be holding right where that area is fractured. So once she gets her wrapped, I'll go get the splint part ready. And your splinting options, it's going to depend on the size of the leg. You can do 5x30s if you need it. If it's just a skinnier person, I'm trying to think of what else sizes we have, Andrea.
I think there's 4x15, but I don't, or 4x30. I think there's a 4x30. If you've got a small leg like hers.
So you have like 4x30 or 5x30 are going to be your best options. In someone who is more thin, the 4x30 should be fine. I guess it probably depends on what's broken too. So if you have like both like if you have more of like a bimalleolar fracture where they're broken on both the internal and the external, like their tibia and their fibula, you might want to do a 5 just because it's going to wrap around a little bit better. But once again, you can always ask your provider what's best. But same type of situation, it's just longer. I think we can go ahead and get wet. Jen, do you have any tips about wrapping or?
No, I just, there's really a lot more tearing involved when you're doing a foot. Especially to make sure you're getting kind of the back of the ankle really well and kind of the heel of the foot. I find myself kind of tearing
Right at the heel.
a lot more to kind of have that area up.
The heel's a little bit awkward.
You can even just take some pieces and pull them over the foot.
Like a stirrup.
Yeah. Just to kind of give some padding there.
Oops.
Too many want wrinkles at all, or
You look so happy.
Patient's foot ankle is at 90 degrees.
To avoid foot drop? Is that what? Foot drop is a big pet peeve.
Yes. Alrighty. Okay, so you've got their foot at 90. You're going to do the same thing where you bring the splint down. And really with the leg going all the way up high is, if anything, just helpful because it stabilizes that whole joint. Back of my knee.
Mm-hmm.
And then you just do kind of the same thing. So you're going to help this kind of form along here. You got to be careful with how you wrap this side. But you want to get it wrapped sooner than later so that you can help form that a little bit better to their heel.
Do you do anything special with the corners, Jill or Jen?
I just kind of tuck them so that they're not pointed in. Do you want me to do something special?
No, I just, some people forget to like tuck them or miter them,
yeah.
so.
You just want to keep them more formed so that they're not sticking straight out, but you don't want to jam it into their heel as well. And you can use the big green one. I don't really like it, but some people do. That's fine. I usually just use 2 of the blues. Sometimes 3 of the blues. I like the blues better than the green. Whoops. Don't mind my inability to keep it together. Okay. So same type of thing. The biggest thing with this one is just for sure holding it so that it stays.
I definitely hold this one until it starts to set. That way it stays
Yeah.
at 90. Because if you let go a patient's natural I mean, they just kind of drop their foot down, so.
Which, if you can get them in a chair, that part might actually be easier because they're not putting weight down on the back of this on a bed. But honestly, whatever's easier. Some of these patients you're not going to be able to get them out of a bed, and some of them you will. But so just like she's doing, she's not pushing her finger, she's not, you know, gripping into the cast to create dents. She's actually
kind of
putting most,
holding, my palm is more on her toes to kind of hold her.
But she's keeping that flex so that her ankle is coming out to that 90. And again, you don't have like wings sticking out the sides here. They've all kind of been lightly tucked up into the heel, but not pushing inwards. And that was really just taking the side of it where it's not the actual fiberglass and folding it up versus not actually pointing the splint, like making indentations into the splint. It's just tucking those sides up so that they stay. I think that's really it. Same thing, you're going to check cap refill, you're going to have them move their feet, move their toe. You're going to get them fit for crutches. And that's it.
Ma'am, please don't take your splint off.
Don't take your splint off. What are you doing? We worked hard all night.
Alexa, put your splint on.
Do your own splint.
Alexa, do your own splint.